Hello, this is Dr. Michael Lau. In this video, I will discuss with you the topic of attraction and intimacy. Basically, this is a video overview, some of the topic of interest to you as you want to know more about attraction and intimacy. So in this video, I'll try to answer some of the questions that you might have. Am I attractive? How can I be feel more attractive, and also how can I feel more confident in intimacy? So actually, many aspects of attraction and intimacy come down to the concept of perception. So what's perception? You could have a visual perception, an image. You look at this photograph, it's in black and white. I think it would be very hard for you to figure out what that is. However, if you look at this picture of the same thing, except it's in color, it's very obvious. It's a beautiful butterfly on a blackberry bush. So as I said, perception is important in intimacy and attractions. So in this case, the term that we use in neuropsychology is called predictive perception. Basically, you said the brain will recognize something based on your memory, what you have perceived before, in this case, an image, a visual perception, that you recognize the butterfly on a blackberry bush right away. So in many ways, in intimacy and attraction, like for example, the smell, the fragrance could trigger a predictive perception that you smell something, your mind right away will come to certain kind of predictive perception about what's going to happen. So in my video library, there's a video that I presented covering a talk I gave in 2020 in the European Society for Sexual Medicine, covering the same topic about how perception, predictive perception, and sensory input all play into intimacy. As a professional technical presentation, but if you're interested, you can look at it. But basically, I extract information from that talk and turn it into something that can be applicable and of interest to the general audience as well. So what are the input that affect attraction and intimacy in terms of perception as well? So sight, what you see, smell, sound, taste, touch, plus internal perception. Basically, that means how your body feel internally. And then this all modified by predictive perception from your experience, your memory. So all this concept can put into a diagram, a schematic diagram that shows the process. As a simplified version of the one that I gave in the conference to the other doctors. So basically, you look at a block, the input including all the senses, the sight, the sound, the smell, the taste, and tactile, add to your interoceptive awareness, how you feel inside. Those are modified by predictive perception I explained in the past. The past memory affects it. And all go to the brain, the central processing, add to further, user memory, data memory, things you had learned and experienced in the past, all modify that. And you come up to the output, which is autonomic, which is how your body internally will respond automatically, and motor response, something active your brain would direct your body to do. And that will generate a neurofeedback, how the body respond, and back to the input again. So that is a good diagrammatic description how the process of attraction related to intimacy will work. So what are some of the things we can do or influence to improve? Some of the things we cannot change, but things like the sensory input, the sight and sound, smell and taste and tactile can all help you to improve attraction and also in the satisfaction and intimacy. You can even modify predictive perception by changing the input or memory, and the central processing to some degree, as I explained to that, and the body will respond accordingly to the input that you improve to be more attractive and be more satisfying in intimacy. So there are certain things we can do to improve both attraction and intimacy. I limit myself to the 3 topics that we can do something about within my realm as a cosmetic medicine specialist and cosmetic surgeon. Sight, aesthetic procedures, cosmetics, and skincare can help with that. Smell, you can modify the body odor and fragrance as well to help with the smell. And tactile, the skincare products and procedure can help with the tactile input. There are actually things that you can do even to the brain to help you both in the central processing and the predictive perception to help you become more attractive or feel more attractive and be more satisfying in intimacy. There are things like mindfulness, dopamine beauty, neurocosmetics, diet and exercise, and then last but not least, therapeutic measures. We can all understand more as we discuss more in each topic as time goes forth. I'm a cosmetic surgeon, specialized in cosmetic vaginal surgery, having been trained both in gynecology and cosmetic surgery. I'm also an aesthetic medicine and sexual medicine specialist as well. But I'm also a scientist. I was trained in technology management and also chemistry and physics with advanced degrees in those areas. I've been actively doing research both in the United Kingdom and also in the United States, being a clinical faculty at the University of Washington and also a visiting scholar at University of California, Irvine in electrical engineering and biomedical engineering and computer science. So I'm interested in the different area of attraction, perception, intimacy, senses, and the neuroscience of those areas. And I published several papers covering those areas, and I have several patents covering, again, invention in those topics. Because of my background and experience, I can advise my patients about the latest innovation in aesthetics and how to improve it by changing the perception as well. Procedures like body contouring, cellulite, laser skin health, skincare procedures, and skincare products. I've been involved in all those areas, both in research and development, and also have patents granted covering the invention in those areas. So I can really actively explain to you what we can do, both in terms of science and the clinical aspect of it. So certain things I do are very specific in terms of cosmetic vaginal surgery. We can refer to this website and also to my clinical website that cover the various aspects of vaginal cosmetic surgery, vaginal rejuvenation, labioplasty, a combination thereof. Those are very specific needs that not everybody needs, but it's available. Also, not everybody needs it, but for certain people, maybe the application of neuropsychology can help to improve the attraction and intimacy issues. Having the science and art available to help you if that's needed as well. Well, at the conclusion of this video, thank you again for your attention. Please browse through some other videos in my library. I'll be updating it at least once a month, covering the topics that we have discussed in more detail, such as dopamine beauty, neurocosmetics, some other aesthetic procedure. So that may be of interest to you. Please subscribe to the channel so you'll be notified of a new video coming out. So hopefully we'll see you again in the near future. Take care.